Hello, leaders. Welcome back. I'm so happy that you're here because, again, it's your commitment to helping your healthcare workforce heal their heart from everything they experience. And heck, you could use it too. Now, listen, today's podcast is all about solving one of the most painful problems in healthcare. We're going to go to our great friend, Patrick Lencioni's work, Death by Meeting. You may have read one of his favorite books of mine that I absolutely love called The 5 Dysfunctions of a Team. And if you haven't read it, oh boy, you need to get it because I feel like that should automatically be in every single leader's sort of toolkit when it comes to your education. But Death by Meeting is this really, really great fable and story. And it covers this man. His name is Casey McDaniel, and he is a founder and a CEO of a company. It's a software company called Yip Software. And not only is the company in trouble, but one of their significant issues is inefficient and unproductive meetings that suck all the life and the energy and time out of anybody that's in attendance. And I will tell you, I've had a very long career in leadership, and I too have had my share of being part of these types of meetings. And I'm going to share with you a bit later a technique that worked for me when I worked at an organization. It actually worked beautifully. And in fact, after that initial adjustment period of everybody learning a new way of working, the meetings were incredibly effective. And it wasn't Patrick's work, but I will tell you it's still meaningful to me because the organization that worked on this as a process had used lean methodology to solve this very complex process, to identify all those little wasteful steps that literally produced ineffectiveness and a lack of productivity, and people really leaving a meeting frustrated and annoyed that their time was not well spent. So we'll talk about that at the end of our podcast. But I want to talk about the fable and the story a little bit because I'm not going to spill the beans and tell you all of this great work. You're just going to have to read it and review it yourself. But what I love in the book is Will in Peterson is assigned, and he helps Casey McDaniel transform these meetings into a different way of working. And there are some powerful lessons in the book about Will's observations and his recommendations. Listen, y'all should be reading it because I say it all the time as a leader, your time is your greatest commodity. You have to learn how to develop your skills and your competencies around time and organizational management to be able to achieve very high levels of productivity and efficiency. And you're also going to need to be that effective leader, which means that if you're running from meeting to meeting to meeting to meeting, you have to ask yourself, what about the people? Because leadership presence is one of those non-negotiable aspects of leadership. You have to integrate daily and regular interactions in business and in social situations to engage with your team members. And for those of you that are thinking, why do I have to do this? I feel like I'm going to grab you and just say to you, as healthcare workers, they are managing very complex and challenging situations every single day. And if they're not seeing your presence, if they're not feeling your presence, if you're not even interacting with them, they are forced to manage those situations by themselves or with their peers. And they will not stay for long periods of time. And we know from the research when leaders get involved, it suddenly takes it to a whole new level. I'm not talking about mediocre leaders who are scraping by and just going through the motions. I'm speaking about an exemplary leader, someone that you want to strive to become, that has this ability to connect with people. And if you don't have the ability, you are learning to do it through practice and mastery. You're learning the importance of inspiring and motivating your teams, and you're learning the importance of being present and forming connections. Why? Because the people that you care for as a leader, they turn around and care for people. And so if that exchange isn't happening well, you can be guaranteed and 100% sure it's not going to go well with them and that person. And while you're at it as a leader, and you're rounding and you're interacting, you should be celebrating all the great things while you're providing support. And whether that's physical and emotional or removing all that red tape that's getting in the way, I mean, that's what people are looking for their leaders to do. And it's going to take leaders to be bold enough and courageous enough to really look inward and examine their own practices through self-reflection. And this is going to be hard, because this is where the deep work happens. For some leaders, this is where the really challenging work happens, because you must really train yourself to look inward and look at things from a different perspective. And I just believe that we all need to do this, because if you look at the way we interact as human beings, we have this natural tendency to, when something happens, we tend to look outward. I mean, we're not really looking inward and saying, gee, how could that situation have been differently, and what could I have done differently in handling that situation? No, nobody's doing that. Only a few people are doing that. The people that are doing the deep work. Typically, people look outward to be able to place blame. And it is so incredibly dangerous in healthcare if you're a leader and that's the practices that you do. You are setting yourself up to be disappointed, because your team members are going to be looking at you as the role model, and they're going to be saying, well, if it's okay for them to do it, then I can do the same with my patients that I serve. And I'm going to remind you, I feel like it just needs to be said, this is line in the sand time for us as leaders. I mean, the buck stops here. And so if you're a leader, this needs to be your call to action. This needs to be your ability to look inward and to reframe out those experiences. And first, to build in that step, to look inward and resist that temptation to look outward, to place blame, and to really think about how something could have been done differently. Now, before you start freaking out, I'm going to remind you, I want to be really, really clear here. You know, as a leader, you still need to look at system-wide failures or failures at an individual that directly relate to compliance or patient safety or any kind of poor outcome or care delivery. You are at the helm, and you must guide the team on looking at things from a lens of doing a proper and appropriate root cause analysis. You've got to understand what happened so that you can put preventative measures in place, whether that be through education or adjustments in systems or processes or policies. That's still your responsibility. So that has to happen. But I'm just saying, in general terms, you can look at things when things don't land the way they should. Look inward. How could I have handled that situation differently? I've seen a lot of leaders make silly little crazy mistakes, right? Not paying attention to what's happening around them. So, it's so important for me to get this conversation off my chest, and I'm going to deliver it to my team member at the worst possible time, where A, they're not prepared to hear it, and B, they're not going to hear it. They're going to walk away and be disengaged. So looking inward allows you as that ability to look at it differently. And again, I'm always going to be reminding you, you've got to protect your greatest commodity, which is your time. You don't have time at your disposal. I mean, we are cramming so much into our day. I mean, I really thought at some point technology would take some of those burdens away for all of us. But I feel like we do so much more even than we ever had to do before. And that's what makes this book, Death by Meeting, such a really remarkable fable. Because I found that when people don't create sort of a strategic approach to making sure that the meetings that are happening are effective, very often and very naturally, what happens as a result is meetings become a huge waste of people's time. And people get very, very frustrated and disappointed. So, what do I mean by that? I mean, we have to sometimes admit, and I know for me, this was a big part of my leadership development. I needed someone to guide me and direct me. And when it comes to meeting effectiveness, sometimes you might be that middle manager, right? You might not be at the top where you can influence a change or make a change happen. But sometimes you still need to advocate and protect your time. And so that conversation might look like, I'm having challenges with managing my time and all my deliverables and working with my team to support them with all the meetings that we have here. Can you help me prioritize and do things differently? I mean, taking that type of an approach is really going to make a difference in the way the conversation just begins to start. And I will tell you, I know it to be possible that you can get to mastery here, because I know when I worked on this meeting effectiveness project way back a long time ago, has to be, maybe 12 years ago, maybe even longer, could be even 15 years ago. Every single one of us was drowning in the day-to-day meetings, right? I mean, just not having time to be able to do what we had to do. And so there were a lot of things that we learned from this project. And I want to share some of them because, again, at the end, I'll tell you which organization gets the credit for it, because they really did a remarkable job. And it really changed the way everybody saw time and organizational management, especially with their meeting. So what did they do that was so unique and different? And how did it work? It was so simple. I mean, every single person that worked in that organization, whether it was in the United States or any part around the globe, everybody was retrained on the purpose of why this initiative was done. That we want to be respectful and make sure when meetings are occurring, it's a good use of people's time, people are coming prepared, and outcomes are coming out. And we're not just spinning our wheels on the hamster, right, on the hamster wheel. And so that was incredibly important. I think that the number one thing that they did in the very beginning, and again, I'm recalling this in my mind, is they really made sure that they stated the purpose and the intent of meetings. And I think sometimes this gets lost, right? When you really think about this in practicality, we think that everybody really has a good understanding of what's the purpose of coming together as a group of people and meeting. And quite simply, it was that, in this organization, people were spending way too much time in meetings. It was preventing them from getting their work done. It was preventing them from producing outcomes. Everybody was getting frustrated. People were on that wheel, right? And that was the purpose. The purpose was, how do we recognize that we're doing things over and over again, and how do we call a time out and be bold and courageous enough to say, let's look at this and let's look at it differently. So I love that they did that. And they did that sort of widespread to everybody. It didn't matter who you were. It was like, just everybody got that education. Number two, what I love that they did was they did a really good job with vision casting, which again, this is an essential skill in leadership. You have to be able to articulate a very clear vision for the people that you're supporting. And they did this very beautifully by, taking it to a place of what if. Like, what if you went to every meeting and you knew exactly not only what was going to be discussed, but you knew what the time frame was for each of those discussions. You knew what the objectives were going to be coming out of those meetings. You knew that everybody was going to come prepared, that it was going to be efficient, that there were mechanisms in place to go from top down and across in the organization in terms of communication. And it was very respectful of your time, that somebody really used that time to think of, how do we actually create this structure? And it sounds pretty simple, right? I mean, it really was. It was just that simple, and it makes complete sense. And I'm going to remind you, as a leader, productivity, efficiency, these are areas where we need to constantly be thinking of, especially with our team members. I mean, Gallup has shown it in their research with employee engagement that, if people don't have the tools and the resources to do their jobs effectively, and they can't answer an abounding yes to that question, there's a higher probability that that's going to be a factor that's going to lead to disengagement. And so we as leaders have to always be looking at it from that lens of, what are those things that are getting in the way? And meetings could be one of those things for you as a leader, because maybe it's preventing you from spending time with your teams. It certainly might be a way to look at how you are orienting people into roles and making sure, do they know how to run those meetings efficiently and effectively and to do them extremely well? I think the third thing that they did, which was pretty darn remarkable, was they outlined what a proper agenda should look like. And I really, really appreciated this because, again, before you start groaning and thinking about, I can't even think about finding time to do this, right, in the form of a meeting, I'm going to tell you from experience, you can't tell me that some of the meetings that you attend on a regular routine basis aren't just rinse and repeat with people saying things over and over again, right? And not moving the needle forward to take it to that next place. And so there's a lot of work that has to happen with the agenda, and whoever owns that meeting as the meeting owner really has to think about the team and who's best to field the discussion, who's best to keep the team engaged. And again, this is a little bit of homework here, but the payoff is tremendous when you go down this road and you begin to think about this from, the perspective of your time is your greatest commodity. So what did they include in their agenda that was very unique? Number one, at the very top, was the purpose of the meeting. If you were the person organizing the meeting, you had to make sure it was very clear. This is why we're all getting together. People needed to know. They found this in their project when they were actually leading this whole project and this big initiative. They found in the research that, people that knew and could prepare in advance what was the purpose of a meeting, they were more apt to be prepared or come prepared to discuss that topic. And remember, you're dealing with people that are introverts and extroverts. So, your extroverts might be able to think on the fly, but your introverts, they may need to think and come back in a little bit of quiet and be alone in a more private setting to be able to get their thoughts together to be able to articulate those out to the group. So that's why that purpose is so incredibly important, because you're leveraging the strengths of your entire team. And I love how they provided an agenda that gave several examples of how an agenda should follow a natural and reasonable flow that makes sense for your organization. So, you're talking about the most important topic, and that leads into the next, into the next, into the next. And the order in which that was done really should have been a discussion between whoever was organizing the meeting and that person's boss. Like, help me make sure that this is on point, right? That the direction, the topics, and everything were together. And I know what you're thinking. That seems like a whole lot of work. Trust me when I say it was a remarkable change in efficiency and productivity. I mean, people started operating completely different, and people were coming out every single meeting with clear deliverables, knowing exactly what those actions were that needed to happen. And even in that agenda, there was a time slot that was identified for this is how long we're going to give ourselves to discuss that topic. And again, before you start balking at it and coming up with 50 different reasons why you shouldn't do it, and for the people that are in meetings, this is what you're looking at it from that lens of the people who are in the meetings. So if you're running the meetings, the people that are in the meetings, you want them to be fully engaged so everybody gets the most out of it. They're not on their computers doing all kinds of other work and not fully engaged. So I've seen this. I've seen this a lot in healthcare. There's a lot of times in healthcare, people just come into meetings and they're coming in wheels up, from the car, very big, not a lot of preparation, not building in a lot of time, just thinking about like how it's going to go, what needs to happen, who needs to do what. And as a result of that, nothing really gets done, right? So obviously, whoever's running the meeting has a responsibility to make sure that whoever's on the agenda knows that they're on the agenda, right? The time that's allotted is sufficient for that person to be able to guide the discussion or get to a deliverable. And, in the beginning, I would say, the guidance was sort of given. If you're, not sure, people tend to shoot for less, and then the meetings just continue to go on for longer. And again, I would argue and say, if you're in that bucket and you see that happening, sometimes you have to look inward and sort of say, like, what's happening here? Because, again, if people are going way over time with their meetings and one meeting's blending into the next and the next and the next, you really do have to think about this from that lens of like efficiency and effectiveness. So they did have some basic rules for this meeting effectiveness project. They always identified a scribe. So whoever was the meeting organizer had to choose somebody that was going to be tasked with being the scribe. Their name was on the actual agenda. And for some people, they would be asked. For other people, it would be that person has a natural skill of doing that. But the person was a scribe. Their job was to keep the notes and all the actions organized. And they could just provide that sheet of paper back or type that up in their computer and send it off email to that meeting organizer. They also identified a timekeeper, and that timekeeper's person's role was really simply just to make sure everybody stayed on task to topic. So if someone was allocated 15 minutes to talk about something and we were 10 minutes in and we haven't gotten to the meat of it, the timekeeper knew, at the midway point, it was like, all right, you got to make sure everybody's aware. We got to stick on time with this and move things along. And one of the other things that I really loved that they did in the process was they had a parking lot attendant that was also on that agenda, right? And so the person in the parking lot, their job was, they manned the flip chart. So, or they wrote it down or typed it up in their computer. So if the conversation veered off from the original stated topic, it was like, that's a great point, but that's not for this meeting. We're going to add it to the parking lot and we'll add it for another meeting. And I love that they did that because sometimes, when you get a large group of people together in a space, people start using that as a brainstorm session and then your whole meeting gets hijacked and derailed. And so I think one of my favorite rules that they had in place, and I'm not going to lie to you, for me, this was a really, really hard one because I ran a lot of meetings and, I had a mental sort of challenge with this, and I'm not going to lie to you. They had a rule that every meeting had to end 10 minutes before time. So what do I mean by that? I mean that if you had an hour meeting that was planned, you only had 50 minutes of your time. That the meeting had to end at 50 minutes to allow people to travel to either that next meeting to gather their belongings or to have a side conversation. And that was really challenging in the beginning. And I would say probably the best strategy that they used when they were really looking at this was, you just use your judgment, right? If you don't think you can get your content done in 50 minutes, then you're going to call it an hour and a half. And you're going to say the meeting will be an hour and a half. However, the agenda will show that we will be done in an hour and 20, and really sticking to that. And that's a hard one for people to adopt. I know for me, I was constantly in the very beginning, I remember having conversations with me like, wait, remind me, when are we stopping? Like, when are we, because, that's, our brains don't always naturally work like that. But that 10 minutes makes sense, right? If you're in a position where you're moving from meeting to meeting, the most embarrassing thing that can happen is you arrive late at a meeting because you literally finished a meeting seconds before, or had to jump off a meeting to jump on another meeting. And you know within that window you can't properly shift gears, prepare your thoughts, and come up with a plan for that next meeting within nanoseconds. It just doesn't happen that way. And so you're losing a lot of productivity in that window. And I really, really love that. And one of the other things that they had in this program, which was, I will tell, I'm not going to lie to you, there was a lot of resistance organizationally with a lot of people on this one, but it was rolled out in this way that every Monday morning, everyone's calendar would be blocked off for a block of time that was specifically used for planning. So what do I mean by that? They used 2 hours, so no meetings could occur between the hours of 8 and 10. That was your time as a leader in the organization to plan out your week, think about your meetings, think about your agendas, what needed to be discussed, contact people by, contact somebody and say, hey, can you do this? Can you do this? Get all your ducks in a row so that then during that 2-hour window, you had no excuses. You had your plan for the week. And I know that seems really difficult to imagine in healthcare because of the way things change in the healthcare system. I mean, meetings get derailed all the time. But I would still challenge you as a leader, if you are not creating a plan for the week for yourself on what are those things you need to accomplish and what are the meetings and the people you need to collaborate with, you're disadvantaging yourself. You're going to wind up ending your week getting nothing done. And then you're going to be incredibly frustrated. You're going to be saying to yourself, where did my week go? I mean, I literally got nothing done. So part of this piece is, doing that high level deep work that gets you to that point where, you can really look at it from a different perspective. And I will tell you, I even loved how they thought of everything when they rolled this process out. And it was so remarkable. Sometimes it just, I wish I had a copy of it, but I don't. But hopefully somebody has a copy and they could provide it, right? But one of the things that I absolutely loved is the last item on the sort of that meeting effectiveness and the rollout and sort of the rules and making sure we were all being respectful of like the whole program and why it was designed and why it was created was this little statement at the bottom that said the meeting rooms need to be tidied up with the chairs put back in when you leave the conference rooms. And boy, did I love that, because people got into a regular habit. And for some people, I'm going to tell you, this was really hard for people, but in healthcare, this should be an easy one for everybody, right? Think about it. I mean, you want your healthcare workers, like everybody, every patient that comes into your healthcare center, your organization, to be met with sort of like cleanliness and organization and like a really good experience, right, of coming in. And so if leaders are having a meeting, right, and chairs are all strewn about, I would say the next person coming in is probably sitting there secretly thinking, like, how come everything isn't tidied up, right? And so this is something this organization did. It was extraordinary because, boy, it didn't take long, right? Like, people made sure their stuff was put away. The meeting room looked good and presentable. And again, I think it was just a beautiful example of how we can look at one of the most challenging things that we have in business, not just healthcare, in business, which is managing meetings effectively, how it can be looked at and how it can be improved and made better. So I'm going to tell you, I think this was such a fabulous idea. I'm going to give props to the organization that did it. This was Novo Nordisk. What a great initiative. And again, probably like 12 to 15 years ago, so all my friends that were doing lean at that time, you all remember. But they get shout out for that because they did extraordinary work and it just became part of everyone's routine. And I want to get back to Patrick's book because Death by Meeting, I feel like, he talks in this book about a lot of typical meetings that leaders have on a regular routine basis. So like your daily check-ins, your weekly tacticals, your monthly strategic meetings, and like a quarterly offsite to like where you're at with your progress. So if you struggle in those areas, like like our meetings could be better, I would suggest pick up the book. And if you're the person in the middle and you're like, oh, I don't really have influence and the ability for people to sort of change and evolve and change our meetings, then just maybe buy the book and walk around with it and take it to the meetings, and just talk to everybody you know about how awesome this book is, right? And pretty quickly, people will be like, what is this all about, right? Because you want to spread the love around the book. I love the work because I just think it speaks to people, and we all need to be mindful that as leaders, as one of my greatest mentors reminded me and said to me all the time, never forget that in the end of the day, you care for people, right? We take care of people. And in healthcare, those people take care of people. So if we are not doing our part, if we're in those meetings, if we're not organizing and managing our time well, and we're not able to move the needle, it's okay. You can learn how to do it through practice and mastery. And if you really struggle with this, just DM me and I'll see if I can help you and send you any tools or resources that I might have as well. Listen, I hope you enjoyed this podcast. I hope this topic of death by meeting sort of inspired you and made you think about how you're using your time and just got you thinking how you could do it differently. And thank you for every single thing you do every single day as a leader. We couldn't do this great work without you. Goodbye, everyone.